Understanding hematuria in cats, causes, diagnosis, and treatment of bloody urine. Introduction. Discovering blood in your cat's urine can be a distressing experience for any pet owner. Hematuria, or the presence of blood in the urine, can indicate a range of underlying health issues, from relatively minor urinary tract infections to more serious conditions such as urinary stones or even cancer. In this comprehensive guide, we delve into the causes, diagnosis, and treatment of hematuria in cats, offering insights to help pet owners navigate this concerning symptom with knowledge and confidence. 1. Understanding hematuria. Definition. Hematuria refers to the presence of red blood cells in the urine, which may give the urine a pink, red, or brownish color. Types of hematuria. Hematuria can be categorized as gross hematuria, where blood is visibly present in the urine, or microscopic hematuria, which is detected under a microscope during urinalysis. Potential causes. Hematuria can arise from various parts of the urinary tract, including the kidneys, ureters, bladder, or urethra. Identifying the underlying cause is essential for appropriate treatment. 2. Common causes of hematuria in cats. Urinary tract infections, UTIs, bacterial infections of the urinary tract can lead to inflammation and irritation, causing blood to appear in the urine. Urinary stones, urolithiasis, the formation of mineral crystals or stones in the urinary tract can cause abrasion and damage to the delicate tissues, leading to bleeding. Feline lower urinary tract disease, FLUT. FLUT encompasses a group of conditions that affect the bladder and urethra, including idiopathic cystitis, urethral plugs, and urinary obstructions, which can cause hematuria. Bladder or kidney infections, infections of the bladder, cystitis, or kidneys, pyelonephritis, can result in inflammation and bleeding within the urinary tract. Trauma or injury, traumatic injury to the urinary tract, such as a fall, accident, or foreign body ingestion, can cause bleeding. Neoplasia, tumors or cancers of the urinary tract, including bladder tumors or renal neoplasms, may present with hematuria as a symptom. Other conditions. Hematuria can also be associated with systemic diseases such as kidney disease, coagulation disorders, or exposure to certain toxins. 3. Recognizing the signs of hematuria. Visible blood in the urine. Gross hematuria is characterized by the presence of visible blood in the urine, which may range from light pink to dark red in color. Straining to urinate. Cats with hematuria may exhibit signs of discomfort or straining while urinating, often accompanied by frequent trips to the litter box. Changes in urination habits, increased frequency of urination, urgency, or inappropriate urination outside the litter box may indicate underlying urinary tract issues. Lethargy or pain. Cats experiencing hematuria may exhibit signs of lethargy, decreased appetite, or vocalization due to pain or discomfort. 4. Diagnostic evaluation. Physical examination. A thorough physical examination, including palpation of the abdomen and assessment of the urinary tract, can provide initial clues to the underlying cause of hematuria. Urinalysis. Urinalysis is a critical diagnostic tool for evaluating the urine for the presence of blood, bacteria, crystals, or other abnormalities. Microscopic examination can confirm the presence of red blood cells and provide additional insights. Diagnostic imaging. Radiographs, X-rays, or ultrasound imaging of the urinary tract may be performed to evaluate for urinary stones, tumors, or other structural abnormalities. Culture and sensitivity. If a urinary tract infection is suspected, a urine culture and sensitivity test may be performed to identify the causative bacteria and determine the most appropriate antibiotic therapy. 5. Treatment options. Antibiotic therapy. If a urinary tract infection is diagnosed, antibiotic therapy targeted against the identified bacteria is typically prescribed. Pain management. Analgesic medications may be administered to alleviate discomfort and pain associated with urinary tract inflammation or obstruction. Urinary acidifiers or alkalinizers, depending on the underlying cause. Urinary acidifiers or alkalinizers may be prescribed to help dissolve urinary stones or prevent their formation. Fluid therapy. Intravenous or subcutaneous fluid therapy may be necessary to maintain hydration and flush out the urinary tract in cases of urinary obstruction or severe inflammation. Surgical intervention. In cases of urinary stones, tumors, or obstructions, surgical intervention may be required to remove the obstruction or address the underlying condition. Lifestyle modifications, dietary changes, stress reduction techniques. or environmental modifications may be recommended to manage chronic conditions such as flood or recurrent urinary tract infections. 6. Preventing recurrence and long-term management. Hydration. Encourage adequate water intake by providing fresh, clean water sources and wet food diets to help maintain urinary tract health and prevent urinary concentration. Stress reduction. Minimize stressors in the environment, such as changes in routine, household conflicts, or environmental stressors, which can exacerbate urinary issues in cats. Regular veterinary checkups. Schedule regular wellness exams with your veterinarian to monitor your cat's urinary health and detect any signs of recurrence or progression of urinary tract issues. Dietary management. Feed a balanced diet tailored to your cat's individual needs, with consideration for factors such as age, breed, and any underlying medical conditions that may predispose to urinary issues. 7. When to seek veterinary care. Immediate attention. If your cat exhibits signs of severe pain, distress, or inability to urinate, seek immediate veterinary care, as these may indicate a urinary obstruction, which is a life-threatening emergency. Persistent hematuria. If your cat's hematuria persists or recurs despite initial treatment, consult with your veterinarian to explore further diagnostic evaluation and management options. Systemic symptoms. If your cat exhibits systemic symptoms such as lethargy, loss of appetite, vomiting, or weight loss in conjunction with hematuria, prompt veterinary evaluation is warranted to identify and address any underlying medical conditions. 8. Conclusion. Hematuria in cats can be indicative of various underlying health issues, ranging from relatively benign urinary tract infections to more serious conditions such as urinary stones or cancer. Recognizing the signs of hematuria, seeking prompt veterinary care, and pursuing appropriate diagnostic evaluation and treatment are essential steps in ensuring the health and well-being of your feline companion. By understanding the causes, diagnosis, and treatment options for hematuria, pet owners can take proactive measures to address urinary tract issues and promote optimal urinary health for their beloved cats. Thanks for watching.